You get
Okay, good afternoon to all the attendees. Warm greetings to all the dental students who took time to attend this webinar, Teeth Talk Mental Health for Dental Students in the Time of the Pandemic. I am Michael Mendoza, a faculty member of the UP College of Dentistry and an officer of the University of the Philippines Dental Association. We have all experienced and we are still in the middle of a global pandemic that has drastically disrupted our way of life. For dental students, it seems like your dreams are on pause. That feeling will take a toll on one's well being. The UP College of Dentistry, the University of the Philippines Dental Alumni Association, and the University of the Philippines Manila Dentistry Student Council has organized this webinar with the dental students in mind. As our invite said, we hear you too. We hope this activity will help all of us understand what every one of us is going through. We hope this will help us cope with what is happening and to provide steps for the dental students to continue on and move forward in the time of COVID-19. Looking forward to an afternoon well spent with all of you. Good day. Go ahead, Chancellor. Thank
Oh,
you.
okay. Thank you. Thank you very much. Um, our beloved speaker and mental health advocate, Dr. Gia Sison, the UP Dentistry Alumni Association President, Dr. Rochelle Javier, dental practitioners, students, other health professionals, guests, good morning. I am pleased to welcome you to this webinar that will tackle the challenges to dentists during this COVID-19 pandemic, particularly its mental health impact on the oral caregivers. I commend the UP Dental Alumni Association, the UP College of Dentistry, and the UP Dentistry Student Council for organizing a gathering of this magnitude and significance. This crisis has overhauled the practice of all professions, and its impact on dentistry is overwhelming. Dentists are most vulnerable to getting infected because of the nature of the oral procedures that you perform. This is the reason why routine dental care has been suspended in many countries with high COVID-19 cases, including the Philippines, during the lockdown. And just like doctors, some of you had to limit your consultations to emergencies. One of our faculty members had a tooth fracture during the lockdown, and being an emergency, he had no choice but to seek immediate consultation. According to him, for the first time, he did not see the face of his dentist from beginning to end. The dentist was using PPE level 4. This incident shows that it is possible to continue the practice of dentistry. And again, like doctors, we will have to take extra precaution. Instead of the simple gown and mask, a dental practitioner will be in PPE level 4 and utilize all available means and devices to limit exposure to the virus. Despite these difficulties and threats, our dentists are constantly finding ways to serve. The project UP Dentista para sa Bayan, launched by the UP Dentistry Alumni Association, is a creative way of service, being an online teleconsultation portal for anyone needing dental advice. Delivery of service need not stop. In public service, as part of the College of Dentistry's mission, the college made sure that the virus and the lockdown did not keep its faculty and alumni from fulfilling their duties. A recently concluded online survey of 650 dental practitioners from 30 countries revealed that majority of them were in a state of anxiety and fear during the COVID-19 pandemic. And this is one of the major findings in addition to the dental practitioners' high standard of knowledge across the globe. So dentists from all countries now are looking at COVID-19 and asking themselves, how will this change my practice as a dentist? And because of this high risk to dentists, it is understandable that an element of fear prevails. I commend the faculty and supervisors of the College of Dentistry who have included counseling among their responsibilities. This conference is very timely indeed. The mental health issues for all workers, doctors, nurses, dentists, allied medical professions like the therapists, and other frontliners are very real. I share your anxiety. The anxiety in UP Manila was heightened with PGH becoming a COVID referral center. There are many lessons that we can learn from PGH. The working environment was prepared through engineering solutions. The health workers were given ample protection from the COVID patients. The hospital infection control unit provided guidelines both for the frontliners and the patients. Mental health was at the forefront and opportunities for counseling were made available not only for the patients, but also for the health workers. PGH OPD has opened using telemedicine as a platform for all old patients through the online consultation request and appointment system, or OCRA for short. This is a signal that new normal has begun. Whereas months ago, there was a lot of fear, now I feel that the health workers have relaxed. I am not saying there is no more fear. Some degree of fear will always be present for as long as COVID is here. But more important, though, is the realization that life has to go on. And it starts with the acceptance that this is the new normal. This is the challenge of the new normal for us in administration. We have to offer ample protection to all our faculty, students, and support staff when they resume the clinic sessions. The challenge for all of us, however, is to accept that life must go on. We have to deal with our fears, and we have to trust administration that protection will be provided as we will continue to serve. UP Manila has risen above the crisis, thanks to the community's leadership, intelligence, ingenuity, generosity, and compassion. Therefore, I enjoin you to use the latest updates, lessons, and experiences that will be discussed and shared during this meeting for you, the dental practitioners and students, to rise up to the struggle with more resolve. I earnestly believe that this seminar, this webinar, this online seminar will help mold the mindset of the students of today so that they will reach their potentials to become passionate and competent dentists of tomorrow. Dear students, do not allow this coronavirus to defeat you. Together with the guidance from your mentors and wisdom from the Almighty, strengthen your minds and hearts and win this war. Salamat at mabuhay kayong lahat.
Uh, Thank you, Chancellor Padilla, for your welcome remarks. Can we also call on Dr. Dean Danilo Magtanong of the UP College of Dentistry?
Okay, good afternoon. Afternoon, Ma'am Chancellor. Good afternoon. Thank you so much. Uh, so it has been almost 3 months. We are all facing the challenges of this unprecedented time, and we are, as your educators, teachers, appreciate your understanding and flexibility. as students as this situation continually changes. So uh, we know your worries. We also know your plans have been altered and have come with difficulties and unforeseen challenges. We recognize that most, if not all of you, are dealing with the huge stress that this health emergency brought us. As we all prepare to navigate the days ahead, we want to take a moment to make sure that in this extraordinarily demanding and stressful time, you are taking care of yourselves, specifically as it relates to your emotional well being. So, likewise, on behalf of the organizers, so I thank you all for taking time. Well, most of us probably have the luxury of time these days to be with us today, and this is our little way to help our students, our dear students, handle individual circumstances. At this point, I take the opportunity to thank all the people behind this webinar, the men and women of the UP Dental Alumni Association, headed by Dr. Rochelle Javier as president. Some faculty members who are also part of the board of directors and officers of the UPDAA, like Dr. Michael Mendoza and Els Barroso. Dr. Jean Arevalo, UPCD officer on continuing dental education. Uh, Dr. Charlie Atienza for being always there, the multi-hatted assistant to the dean, Dr. Charlie Atienza. And of course, the UP Manila Information Management Systems, headed by Director Joff Solano, pati yung kanyang mga administrator, network engineer, Darwin Laurencio, and with us here is Ayan Ocampo. The Office of the Continuing Education, the National Graduate Office for the Health Service Sciences, and of course, my good friend, my classmate, Dr. Paul De Castro, belonging to batch 1986 of the UP College of Dentistry. And lastly, of course, our own Chancellor, UP Manila Chancellor, Dr. Carmencita Padilla, for the very big support that was extended to us. Lastly, if I have my way of blasting or having to text you, send you messages using the SMS system or text messaging, I'd probably text you four things. One, that I'd like to tell you, all students, not only of the UP College of Dentistry, but all of the dentistry students all over the country, that number one, you matter and we miss you. Number two, stay safe. Number three, I urge you to get creative. And lastly, I will also text you that we will be here when you get back. So thank you so much. God bless us all. Thank you.
Thank you to our UP Manila Chancellor, Dr. Carmencita Padilla, for gracing this momentous occasion. This is our first collaboration with the UP College of Dentistry and the UP College of Dentistry Student Council that is hosted by the UP Manila Webinars. Thank you, Dean Danny Magtanong, for your warm welcome. And thank you, students from Luzon, Visayas, Mindanao, for being here. A few days prior to this webinar, we were able to collect a few questions and topics from the students all over the Philippines. And it's courtesy of the UP UPCD Student Council, and the Philippine Dental Students Association. Among the many diverse concerns of the students, there was one question that got my attention for its simplicity. It simply read, "In this time of crisis, is it better to be a realist or an optimist?" We at the UPDAA wish that after this interaction with our speaker and our panelists, that you will choose to become an optimist and remain an eternal optimist. Now, I know everyone is excited to hear from our speaker, so let me just introduce her. Our speaker is a medical doctor by profession. She is a breast cancer survivor and a mental health advocate. She graduated Doctor of Medicine from the University of Santo Tomas, took her Master's in Occupational Health from the University of Philippines, Manila, and specialized in Occupational Medicine from the University of Illinois, Chicago School of Public Health and Hygiene. As a health leader, our speaker served as the National Secretary of the Philippine College of Occupational Medicine and a board member of the Philippine Medical Association Committee on Continuing Medical Education. She was also once a consultant to the World Health Organization for the global practice of occupational health. Currently, she is the head of the Women's Wellness Center at Makati Medical Center. As an advocate, our speaker serves as the first Philippine leader of the Livestrong Foundation, an international NGO that aims to improve the lives of people affected by cancer, and currently the national advisor of the Youth for Mental Health Coalition. She is a strong advocate for mental health in the workplace and currently works with companies to improve the wellness of workers. As a media personality, we all know her as the host of the web series G Talks from CNN Philippines. She is also a co-host of Boys Night Out, Magic 89.9, currently writes in her blog Sand and Stone at giasison.com. Friends, ladies and gentlemen, students, I welcome you, a former schoolmate, a friend, she's a brave warrior, a fellow hermana, Dr. Gia Sison. Good afternoon, Gia.
Good afternoon, Rochelle, and good afternoon to everyone. And I know they're not already here, but I'd like to thank Chancellor Carmencita Padilla for gracing our event, and Dean Danilo Magtanong, and to the UP College of Dentistry, UP Dental Alumni Association, and the UP Student Council. Thanks for inviting me. So this afternoon, we'd like to have a conversation with you. Main topic, and I'll be with Dr. RJ Nugget later. Our topic will be mental health for dental students in the time of the pandemic. Okay, next slide. Before we delve into the topic, this slide shows us that we're all familiar with the phases of grief. Now, in psychology, we have what we call the psychological phases of grief. And on this slide from SAMHSA, this was published last 2000, it actually shows the phases that we are undergoing. Pre-COVID, during COVID, and I wouldn't say after because it's still ongoing, and what's going to happen after a year. Because let's face it, based on this study, recovery would still be like after a year. Rebuilding, reconstructing, new beginnings. So on this slide, we'd like to focus on tips, not hard and fast rules, but more or less tips on disillusionment, because a lot of the questions I have read are all about uncertainty and anxiety, which we are all feeling. So next slide. So here are common mental health concerns during the time of COVID and in any pandemic. We are all uncertain about our future. We don't know what's going to happen. No vaccine yet. No one-time medication for it. We are uncertain about our practice. There are some of us who have actually lost loved ones or friends due to COVID. And there is also this factor that we have to adjust to or transition to changes in lifestyle. And I'm not talking about just the lifestyle it would also have to affect the habits that we make. So that in itself is a difficult transition because we're talking about uncomfortable change, but we have to. And of course, there's this factor of heightened emotions due to a pandemic. A lot have been triggered with anxiety. Although just a disclaimer that there's no study yet as we speak on the long-term impact of pandemic to mental health, but based on the China studies, depression already was already top on their list. Anxiety, in fact, even loss of sleep is already there. And there's also a part that there is a challenge in accessing services. Like, how about patients with non COVID symptoms? And patients have already actually been scared of going to hospitals and clinics, which we don't blame them. But then again, we have to find also solutions for them to feel safer and, of course, ourselves. Next slide. So, aside from COVID, the other part of the spectrum is the additional threats of both loneliness and isolation. Because COVID is a very lonely disease. When you are diagnosed or even you're suspected of having COVID, you will have to deal with it by yourself. So basically, we're very social beings, and having to be isolated by yourself away from family is very difficult. So that's the additional threat that's glaring at us. Now, on this slide, this is actually this is part of cognitive behavioral therapy, where we we start to ask ourselves this question: is the stressor something within my control? And on the bottom of your screen, we have the answers. So if it is something that you can control, then you act on it. You do something about it. You think of creative ways in addressing it. If you can control it, but you can control your thoughts and reaction to it, then that's called emotion-oriented approach. Ito yung mga bagay na hindi talaga natin makokontrol, pero yung the way we see it, our perspective, if we change it, can actually help us. And lastly, kung talagang totally wala talaga tayong control, wala tayong magagawa, which COVID did from the very start when it hit us even before March 15, acceptance-oriented approach ang gagawin. So this is cognitive behavioral therapy in a nutshell. So next slide. So these are actually tips, not hard and fast rules that can actually help all of us cope, because the big word we're talking about here is cope. COPE is a big word, and coping is something that is individualized. Lahat tayo, we feel a variety of emotions, and with those emotions, we also cope in different ways. So one effective way of coping is the attitude of gratitude. But this is not the toxic positivity of binabaliwala natin yung nararamdaman ng iba. Of course, we are all in this together. We are all down. Sabi nga ni Dean kanina, if he can only send text messages to all of you, sasabihin niya, wag mag-give up. Kasi lahat nga tayo, we're there, nandun tayo sa punto na ano na mangyayari. But gratitude simply means seeing something that is hopeful in this time where uncertainty looms us. So find that one thing that you're thankful for and magnify on that. Please remember that gratitude does not mean letting go of a stressful situation. It's just that you try to see the beauty na lang out of all these ruckus that we are undergoing. Next slide. Okay. One question too is most of us are working from home. And to tell you frankly, when I saw your Facebook site of dentists volunteering their services, sobra siyang nakaka-amaze. And you may want to make that a routine, no? If you're able to practice. Maintaining daily routines, a schedule, or a set of activities for the day can actually help all of us cope. So there's this one study, I will just have to cite it after this talk. They tried setting routines to a group of people who had post-traumatic stress disorder, and they found it useful. No? Kunyari, 8 to 9, I will do this, then 9 to 10, exercise, something like that. It's the schedule is for you to retrofit according to your lifestyle, but put variety in the activities that you do. And don't forget the basics of health, physical activity, nutrition, yon. So maintaining daily routines, you might want to write it in a paper, stick it in the wall, in a wall where you can always see it. So parang ano siya for those of us who are really visual, when you see it and you get reminded, somehow it can help all of us cope. Next slide. And of course, ang ina-advocate naman na preventive measure for COVID is physical distancing. But physical distancing doesn't mean that we socially isolate ourselves from the support system that we recognize as our own. Family, friends. Dito na papasok yung responsible use of technology. Or you might want to send a text message or call, make that connection with your friends, or maybe even have a support group where you talk about your day, no? Or you can talk about something that is not related to dentistry, something that you love doing. Then makikita nyo na lang, you get engrossed in that support group that you find yourself at least unburdened. So with it, so maintain those social connections. Next slide. This is very important since, frankly speaking, the news is causing more confusion personally. So dito na rin papasok yung limiting ourselves to social media exposure. Choose only the authorities that you will listen to. So example, in the morning, you just have to pupunta ka lang sa isang site like si RJ goes to the IATF briefer, or in the afternoon you go to DOH to get your content and then stop. You also have to be mindful of the time you check social media, because most of the time it can trigger you in a negative way, and we don't need that. So we regulate its frequency as well. Okay, so next slide. And of course, practical help is very advisable. Provide practical help. Ito naman yung, remember the slide I flashed earlier on the additional threats of isolation and loneliness. I'm talking about people who are very vulnerable in terms of this. And I think we all are. And addressing basic needs can actually help. In fact, I was involved in volunteer work up to now. In fact, longest volunteer work yata ng buhay ko yun, because it's still running up to now for 2 months. And we provide food for frontliners and for even some families who got displaced. Volunteer work is practical help that can actually help others and help you. No? May feel good component siya. So if you are ready, you may want to get into this aspect of being able to be a volunteer, providing practical help. Next slide. And I'll go back again to the cognitive behavioral therapy theories, wherein you remember the 3 things that we have to do when it comes to processing our feelings and asking ourselves, ano ba yung dapat ko gawin? So just remember, reflect, examine, and replace. So when you reflect, try to ask yourself, has this happened to me before? What did I do before that actually helped me? So you might want to take on that, and you might want to apply it now because it helped you before, it may help you now. Medyo dadagdagan nyo lang. So that's what we mean when we say reflect. Examine. Examine ano ba yung mga nakakahadlang for me to be able to address self-care, because self-care is very important nowadays, especially now that we are all uncertain. So again, examine how you can address barriers to self-care. And lastly, there's that replace suggestion. Replacing just means the reduction or the elimination of negative coping strategies, and you replace it with something that's positive. So a typical example is, gusto mong magalit, gusto mong sumigaw. That's fine, those are emotions. But minsan, syempre, nakakasakit ng iba. So shift that into something that is positive. You just might want to circumvent the anger by writing it down, by journaling, something like that. That's just an example. But let's turn those negative emotions into something that's positive and something that is productive and will be more helpful in terms of coping. Next slide. And also, I mentioned sleep hygiene because a number of concerns that was brought about by the effects of COVID is the sleep cycle has been nasira na siya, no? Parang nagkagulo. So in sleep hygiene, for those of you na mahilig mag-nap sa afternoon, just limit it to a maximum of 30 minutes. Avoid stimulants na after 4. Why am I talking about sleep in the first place? Because sleep forms a major pillar for our immune system to be boosted up. And that counts, especially wala pang gamot sa COVID, etc. In general ito. Steer clear of food that can be disruptive before sleep. Like spicy food. Kasi ano siya para siyang upper. So, not too much food. And siguro mga 1 hour before you sleep, dim the lights of your cell phone because the glare of it can actually inhibit melatonin, which is a sleep inducer. So dim the lights and make sure the bedroom is just for sleep. You might want to just allot a small space in your pad, in your house na pagkaaral dito lang. Pero pagdating sa kwarto, the bed is just for sleep. That would help. In fact, subliminally, ma-acquire ng brain natin yon. It takes 21 days to form that habit. Okay, next slide, please. So in summary, these are the 4 main mental wellness tips for you and for all of us in the time of pandemic. Limit exposure to negative content. It's okay to read about it. It's okay to be aware. But if you think that it's already triggering you, then get out of it. Number 2, make a daily routine. And in between, don't forget to take care of yourself in terms of your body care, physical activity, sleep, yun mga ganon. Eat nutritious food. I'm pretty sure you all know that as doctors, but most of the time we forget. Number 3, practice self-care. Kasi that's very important. And when we say self-care, that's not selfishness naman. It's just honoring you, honoring how you feel. And then lastly, reflect, examine, and adopt healthy coping strategies. Many of us during these past 60 days have already formed habits by now. And in fact, some have realized that kaya pala nilang gawin ito. So I hope in the coming days, we try to develop this type of thinking in terms of adopting healthy coping strategies to help us through these hard times during the pandemic. Remember, our reopening also does not mean zero risk. Now, we all want to reopen clinics, but not until the vaccine comes out. There's always a risk when you go out. Everyone is affected. So, nasabi nga kanina ni Chancellor Padilla that developing plans in coordination with the students, alumni, everyone should be involved in terms of planning. Kasi lahat tayo involved eh. Then it might help to perform regular check-ins. And of course, very important, merong mental health network na pwedeng puntahan. Parang support group that they can run to. So that's part of planning in terms of reopening. Next slide. And don't forget community care. Mental health isn't always about, of course, it's about you, but the one of the important parts of mental health is community care too. So you have to address also the structural changes and social rearrangements that need to go along the usual support that we give. Next slide. So again, I just like to reiterate that social distancing doesn't mean social isolation. So keep that social connectivity. Now I saw this in a comment here that yes, more than ever, we have to stay connected because it would keep us intact, no? And of course, we all would always think also of the other side that we're helping. Next slide. So thank you. So we're now opening the floor, Rochelle, to questions with Dr. Nagit as well.
Thank you, Dr. G. That's quite comprehensive. I've been encountering the term cognitive behavior therapy. Even on Facebook, you will see that. Then you have your common terms that now is a different, we have a different take on it, which is perspective, your gratitude, the routine, and social connection. So before we see with the Q&A, let me ask our moderator to introduce your co-panelist, Dr. G. Dr. Elch Barroso, good afternoon.
Good afternoon. Good afternoon, everyone. So I would like to introduce our Dr. RJ Nagit. So he is also a mental health advocate, a registered nurse and medical doctor, as well as a Filipino activist. He is the founder and chairperson of Youth for Mental Health Coalition and the chairperson of Akbayan Youth. So he advocates holistic wellness, youth activism, youth engagements in various social issues. So we would like also to welcome Dr. RJ Nagit.
Hello, good afternoon everyone. Thank you po sa pag-organize ng event na to.
Hello, RJ.
Hello, Doc.
Doc G, may I start with a question and answer? Can we start? First, we have been talking about the new normal.
Yep.
And we've been talking about the new normal. It's been discussed. Question nila is, how do we cope with the new normal?
Okay. In the new normal kasi, we'll talk about policy first in terms of sa DOLE. We actually encourage phased reopening. Hindi naman yan agad kailangan bumalik sa practice. No? You have to go on phases and reduce clinic hours as well for doctors. So in the institution I'm practicing in, we're only limited to practice 4 hours a day and a maximum of 10 patients to see. That is pero hindi yan malalayo sa inyo. In fact, there was a dentist who opened clinic that limited lang yung kanyang practice to 2 patients per day. So what I'm saying is phased reopening is there. That's there to stay for quite some time. Of course, PPE use. In fact, sabi nga kanina ni Chancellor Padilla, level 4 ang PPE yung nakailangan ninyo because when you look at the specialties at high risk for getting COVID, dentistry is one because of close contact. And of course, scheduled consultations. Hindi na pwede mag-walk-in tapos hindi na ganon. Processes will change in the new normal. Facing it, no? Facing it pa. Hindi pa yung everyday magki-clinic. Hindi ganon. You have to, may mga reduced number of hours. That's the practical side of those who are already in practice. So, RJ?
Yeah. In terms of coping to the new normal, I think the first thing that we need to understand is that yung new normal na to is something na hindi pa natin alam kung paano siya mag-operate, no? So we're still trying to figure out our way there. But I think yung first thing that we need to understand is that we have to acknowledge that these are very abnormal times. And even the past, yung normal na tinatawag natin before is not necessarily a good normal, no? So it's not working for us. So probably at this point, kailangan natin makita na yung new normal na to can be shaped by us. So, in terms of mental health, napaka-importante nun because it actually talks about our agency as humans to act on certain situations. A few days ago, I was reading about a passage by Arundhati Roy. At doon sinasabi niya na yung pandemic is actually a portal to a world na pwede nating i-shape. So, doon ko lang gusto i-highlight na parang number one, we have agency over the new normal. And second, developing pa ito. That's why even though na mag-set tayo ng mga plans, and I know ginagawa yan ng mga students right now, we have to be open to some changes that might occur because of that situation.
Go ahead, Rochelle.
Thank you. Dr. Michael, questions on your part? Sino ba may next questions?
Ito meron ako.
A question, yes. We have a question here. A few minutes ago, we started how we would function as dentists in the new normal. Nasabi nga ni Dr. RJ, hindi pa natin alam kung ano yung circumstances for the new normal. Okay? But how about for the dental students, particularly for those who are still who will still need to enroll in the coming school year? So the current resolution right now is that there will be no face-to-face classes. So how can the students cope with online classes? How effective would be, especially if these are skill-based courses? How can they adjust to that?
Okay, I'll start now. Please don't let go of your dreams to become a dentist. Magiging dentista pa rin kayo. It's just a matter of literally time. So, you have bigger goals to focus on. And frankly, lahat tayo mangangapa sa online learning. No? That's, again, that's a new approach that we take. Kasi sanay tayo, gigising tayo, pupunta tayo sa school, then we do our academic work. But this time, it will change. So, I think we have to venture into it. We have to try. At least there are options for you to be able to continue. Yun yung sa sinasabi sa cognitive behavioral therapy that wala tayo magagawa, but we can try to shift our mindset into something na, okay, this is gonna be just for now, pero hindi ito yung magiging norm forever. Ginagawa lang to para ma-augment yung education. So, yun, no, never let go of your, yun, always anchor to a bigger goal. No? That's being a dentist. And, yun, ako, para sa akin, that's my take on that.
Thank you, Doc G. So that answers some question here that's saying she's in her last year of school and the daughter is an incoming dental student. Ang question nila, is it still advisable to pursue it? So I guess that answered it, no?
Of course, yes. It's still worth it.
Question lang, the follow-up for that. I'm feeling very frustrated and helpless because of this pandemic. And I also want to know, how do I lessen the anxiety of going back to school?
RJ?
Yeah. Siguro dito pumapasok yung role of the administration in terms of communicating protocols. So I think yung nasabi naman ni Doc Gia kanina na reopening actually carries some form of risk, no? So in some areas the risk might be lower, pero in some areas medyo mas mataas siya. So I think doon pumapasok yung pagkakaroon ng clear plans and the way we communicate these plans to the students. Kasi of course we also need to inform them of the different mitigation strategies that are being done by the school and clear rin yung plans just in case na magkaroon ng outbreak, no? Because we can't actually discount that from happening. So one way, at least yung information to allay their anxiety, and second, to make sure that these practices are participatory in nature. Ibig sabihin, merong mga consultations done by the students and constant yung pagkukumusta sa mga students natin. And just to also comment on the previous question regarding dun sa online classes, I think right now wala pa talaga tayong data saying what really works, no? And I'm not sure also if the educational system is ready for such a shift. But of course, because of this pandemic, we're actually forced na mag-adopt sa mga bagong strategies. So siguro one thing that the teachers can do is to actually humanize yung teaching nila. Like for example, before they conduct classes, probably kumustahin muna natin yung mga estudyante natin kasi very helpful talaga if we acknowledge their anxieties first bago natin sila bigyan ng very theoretical na mga discussions. And of course, at this point in time, since very limited yung interactions via the online platforms, probably pwede tayo mag-proactively reach out sa mga students, no, in some other way para kumustahan sila in terms of mental health. And probably, kailangan rin siguro isama sa discussion yung changing how we evaluate students. Kasi right now, di ba, parang nagkaroon ng shift towards mass promotion or even adopting all of the students will pass. So probably kailangan natin mag-rethink how we also evaluate given na ganito yung situations that we're in. And hopefully, we also discuss paano ba tayo mag-accommodate ng mga students. So probably Doc Gia can share more about reasonable accommodation sa mga students.
Yeah, sa occupational medicine kasi we encourage reasonable accommodation. Kung merong facing ang clinics, meron rin sanang facing in terms of ACADS. So I don't know lang how it's going to be addressed, but I think they have to, like personally as a parent, I hope there are more means that my daughters can learn aside from online. Yung maiba yung, I don't know, parang grading system. Parang more lang, parang mas flexible lang kasi it's not expected that all of us will be 101% productive. Kasi lahat tayo affected and we don't even know how it's gonna run. So, yun yung sa akin. More, a little bit of clarity during these uncertain times can actually help.
Thank you, Doctor. Can we jump to a topic that's a little more controversial?
Sure.
I've been seeing the questions about depression. So most of the students are asking, how do we deal with depression because of the pandemic? And then later on, siguro I'll segue to, I think there's one faculty here who asked about, can I segue na, Dr. G?
Sure, no problem.
Sabay na. From a faculty of, I think I see him in Batangas. Good afternoon, ma'am. As teachers, how will we know if it is legitimate depression? Ayan na, nawala. How will we know if it's legitimate depression or other emotional issues in the crisis to determine if the student is only taking advantage of the situation and escaping from school, works, and activities or requirements? How much leeway and consideration should they give or extend?
Okay, so number one, we say no to romanticizing depression, no? Because that invalidates individuals who are actually suffering from depression. However, there's a fine line between someone who is already opening up about how he or she feels. We have to remember anxiety may be normal. Actually, it's normal to experience anxiety now kasi no one knows what's gonna happen and lives are threatened. Depression, wala pang study, but I think based on the last presser of the National Center for Mental Health, RJ, di ba, there was an increased number of calls they received in the hotline of individuals experiencing a range of emotions from depression to anxiety, iba-iba yan. And hindi naman ibig sabihin normal siya, hindi na i-address. So dito papasok yung support that you may want to offer students and even faculty who experience these feelings, no? Kasi malaking bagay yung talk therapy, no? Pag-usapan yung nararamdaman, to address it as much as possible. Yun. How about RJ ka? What's your take?
Yeah, I actually replied in the chat, but for those who are watching in the Facebook Live, I think mas napaka-importante na ma-identify natin rather yung ways on how we can help. Kasi if the person is already talking about some form of mental health concern, then probably it demands attention. Hindi naman natin kailangan hintayin pa na magkaroon sila ng mental health condition before we actually provide some form of help. So probably if hindi nila kailangan ng specialist, then it might help if you reach out to them as informal community-based support. So yun yung gusto natin i-highlight na mental health exists in a spectrum, and probably yung diagnosis can come after we provide yung initial support to them.
Dr. RJ. Dr. Elge, meron questions on your end?
Yes, a follow-up question, Dr. Gia.
Yes.
For that, is it from an anonymous attendee? Is it normal for the mind of a dental student or a clinician to keep up a facade of being positive, even if he or she is tired? Or is it also normal for the mind to feel vulnerable sometimes? And maybe, what can we do? What can he or she do about it?
My answer to that is yes. There are individuals who are actually, kaya nga sabi ko, all feelings are valid eh. And all of us cope in our own individual way. So some of us see it as a challenge, no, to do better, while some actually feel that it's a hopeless situation. So iba-iba siya. But to put up a brave front when facing patients, that's actually part of the healthcare profession as a whole. But there's a big but. Please practice self-care as well. No, it always is like, I will always compare it, di ba pagka bago tayo sumakay ng eroplano, meron demo na bago yung oxygen mo, lalagyan mo, bago sa iba, maglalagay ka muna ng O2 sa sarili mo. That's actually true in life, di ba? Before you help others, you have to breathe yourself. You have to take care of yourself first. And then, lalabas yun. So, it's intrinsic, tapos extrinsic yung approach doon. But it's totally okay to be vulnerable. It's totally okay to cry. Because you have to feel the emotions to be able to get over it.
Follow up, Dr. Elge?
Another one po. So, how do we help other students naman in regards with their friends, especially medical and dental students, to feel secured and assured of their courses?
RJ?
Because we believe that there are some colleagues that they are opting to change their courses after this pandemic.
Okay, so me muna. Stick to your goals. Kung may senti term nga yan eh. Kung true north mo talaga ang pagiging dentista, pagiging doktor, paglalaban mo siya. Delayed dreams doesn't mean postponed dreams. So go for it pa rin. But realize that it will take time. That's part of the process. Pero wag bibitaw. Kasi lahat naman eh. I think what COVID did to us is lahat tinigil niya. So it's not, we're all in this together in whatever stage we are in life. It all stopped us in a way that hindi tayo na-prepare.
Okay, maybe to add to that, as mentioned by Dr. RJ kanina, we would need also to inform the teachers, inform the school administrators of your needs.
Yes.
We have to admit this will be the first time that most of the faculty members will be doing online or remote teaching. So everybody is adjusting. So there are questions din that were raised on the quality of education. So that would put some anxiety also on the students, even if they're sticking with their dreams. They might still be anxious on the quality of education that they'll be getting. So again, how can we address that? Of course, again, sabi nga, we're all in this together, the students, the
Yes.
parents, the families and friends, the school administration and faculty. But Dr. Sison and Dr. RJ, what can you say about that?
RJ, go ahead.
Yeah, so sorry, medyo naglag po on my part. Can you repeat the question?
Of teaching because we are not
How to adjust sa teaching. Tama ba, Doc?
yes.
Yeah.
Yes, ma'am.
Well, I think for me, since I'm not an education expert, napaka-importante that we actually do consult our students regarding what works and what doesn't. No? So since we're still figuring out what interventions might work, probably kailangan natin magkaroon ng regular check-in with them kung ano ba sa tingin nila yung nag-work at hindi. So I think it all boils down to having participatory mechanisms and open feedback to the teachers. Kasi siguro at this point in time, lahat tayo nangangapa talaga. So probably we have to keep the lines very open to each other.
And to add to what Doc RJ said, I'm speaking naman as a parent, no? Because as we speak, I don't know how the school of my daughters will conduct academic online classes. So that's adding up to our stress. So siguro what we can do is tama yung that word is very important eh. Participatory dialogues or meetings on what will work and what will not. So ano siya eh, we have to meet halfway somewhere along the path of education because compromise na nga siya. We have to make do with our resources. Tapos yung methodology dapat klaro kasi it will cause more confusion. So again, involve everyone. Parang town hall meeting yan eh. You involve everyone, the board, the teachers, the students, even the parents because they will set the tone eh, sa house. So yun, importante yun as we speak.
So dapat talaga
Doc Michael?
yes,
There's a bit of a lag, no?
Yes, meron.
hindi out
May lag ng... Sorry, Dr. Michael, maybe you could type the question. Are you?
Or Rochelle, I can read some. Meron
Yep.
din.
Actually, Dr. G, medyo madami-dami din sa akin. You were talking about online. Ang question nila, how does the academic burden during the pandemic affect the mental health of students? So you answered that. How do you motivate yourself every day? Ito naman, there are two questions about mag-board exams na sila eh. So ang question nila, how do you motivate yourself to study for the board exams in this time of pandemic? I don't feel productive at all. I don't want to review and practice. I don't want to think about school at all because I get anxious. Please give me some advice. Thank you. Kasunod niya, how to get back on track reviewing for the upcoming board exams since there were too many distractions due to recent events, especially this pandemic. And please advise us on how to strengthen one's mental health when surrounded by many negativities, especially for those repeaters of the dental board exam.
Okay, so just to share, I'm a repeater of the medical board exam. I took it twice. Pero sinabi ko naman sa sarili ko, hindi naman yan yung hahanapin ng pasyente. Like, my patients won't ask, Doc, ilang beses ka nag-boards? Tapos pag sabi ko twice, wala na. So parang, I think board exams are just there to formalize your induction into the practice, but it shouldn't define you. Take it from me, coming from a second taker. Yeah, may mga labels pa nga kami, second taker. Pero don't allow it to define you. Now, in terms of motivation, in terms of studies, it will really get affected. It's part of the anxiety. It's part of the uncertainty. So what we usually do is you take it one day at a time. Kung gusto mo magbasa ka ng one sentence in one day, parang it's parang priming yourself to just keep moving on your own pace. Pero wag mong papalipasin yung isang araw na hindi ka nagbabasa, at least one paragraph. So, yung mga little steps na yon can actually form into a bigger habit of getting yourself back on track in terms of studying.
Just to also add, Doc Gia, when I was studying for the board exams, syempre sobrang dami nung kailangan pag-aralan sa medicine. So I was practicing yung what they call the Pomodoro technique.
Yeah.
So mag-work ka for several hours, tapos take scheduled breaks in between, tapos work ka ulit after. So, para hindi ka tuloy-tuloy. Tapos sa pangalawa na I think nakatulong for me is also having a study buddy. Kasi, di ba, minsan yung accountability natin sa sarili natin, hindi natin makontrol yun eh. So, probably, we have to have someone to check up on us kung nag-aaral ba talaga tayo. So, probably that can help. But, of course, there's no one way of motivating oneself. And, of course, we have to recognize that in a pandemic, probably our motivations may be affected also.
Yep.
Wow, Doc G, ano yan, a big motivation yan for our board exam takers, yung mga future takers of the board exam. That's a big motivation. Thank you for that. Dr. Elch, more questions on your part?
We have here another one po from Zoom. Okay, so wait. Regarding here we have a question here. Where can we go, or to whom could we reach out, or how can we cope up when these circumstances make them uncomfortable, or if there are people who are invalidating their struggles? Where can we, or can you suggest, Doc, if where can they go or whom they can ask for help?
The crisis hotline, RJ, do you, hindi ko kasi memorize yun sa usap, so you might want to, mention about NCMH hotline.
Yeah, and we also compiled a list of services that you can actually reach out to. So I have here the bit.ly link. So it's bit.ly/mhservicesph. So if you click on that link, it will lead you to a list compiled by the Psychological Association of the Philippines, who offer free to low-cost services. And you can also reach out to National Center for Mental Health USAP hotline at 0917-899-8727. So probably we can make that available later on after this program.
With that po, can you suggest daw any readings or books for mental health or overall wellness?
Depende yan sa gusto ninyo. Kung if you want, kasi ako kasi yung sample books ko ito, but depends on how some like Paulo Coelho, kasi may kwento siya eh. There's a story, tapos may lessons. Yung iba naman gusto hardcore na agad yung tips. So find the book that you relate most to. Then do it. Okay, this is my favorite book. Yan, may sample pa. This is Atomic Habits. Well, this book, kasi, this available sa online. It taught me the habit of forming habits that actually can help. And in that book, it's very clearly stated also how to avoid even toxic people. No? So it's part of the letting go habit. So yun, those are the kinds of books that I read. Si RJ, mas malalim yung books. No?
More than books, ako kasi binabasa ko mga guidelines. So I would really recommend yung Interagency Standing Committee. So they just released some guidelines on mental health and the psychosocial support. So probably you can Google that. Merong PDF file doon. And for those who want to read up on suicide, kasi probably that's also one of the things na kailangan tayo maging concerned about, you can also visit the guidelines for Filipino suicide first aid. No? So that's by Foundation Awit. You can search for them online.
Thank you. Thank you, Dr. G, and thank you, Dr. RJ. I have another question here. I'll put it together na. This, for dentistry students, this is very common. Yung financial issues, of course, for everybody, no? And the dental industry has taken a hit financially. No work, no pay. But for dentistry students, their concern is because they have to buy materials, PPEs, etc. So I don't know if it's still, they have enough resources to purchase that so they can continue. Next, the tip on how to handle the stress because some of them do not have, okay, kasama na to internet connection when you're doing online learning. Also, alongside with that, when you're learning from home, some of them, they don't have the gadgets that will make it work for them. Also, alongside with that, they have chores. And some of them, their parents still do not have work because of the decision of the company of no work and no pay policy. There's so many bills to pay. Nakakahiya na pong dumagdag sa problem ng parents. Kaya po nakaka-pressure kung pagbubutihan pa mag-aral or, not to continue. And I will connect to that. Ayan, ang mga concern nila, how to juggle, because when you're home, your chores, learning, and then the pressure from the finances.
Dito papasok yung routine na sinasabi namin lagi kanina. You might want to set a few number of hours to study and then magla-lunch break and then do your chores and then back to study again, tapos physical exercise, tapos rest. Because that actually sets the tone for the day. And it's like conditioning yourself, which is a big deal. Kahit naman wala yung pandemic, conditioning yourself to work, that can help. Set a routine and post it somewhere that you can always see. Na parang it will, it's tawag doon, RJ's visual cue, di ba? It's actually a visual cue na, ay shucks, ito, gagawin ko na pala to. Ito na yung time ko. So, ano siya, indirectly, it will form your habit of having routines in your life to work for you. Now, when it comes to the study naman, yes, yun nga that's also one of my concern. Paano nga yung mga walang net access? That's why dyan papasok yung dialogue between parents, the admin, the teachers. How can we meet halfway in such a way naman na hindi rin magsasuffer yung quality of education? So these are the dialogues that we wish to have moving forward, especially when hindi pa nga alam kung kailan yung start of school. That pa nga is under question. So I hope someone from DepEd is also listening because these are real concerns. Real concerns, recurring concerns, we understand you, but we hope we had an answer to your question. But let's see where this goes.
Thank you, Dr. G. Continue ko lang. These were the questions beforehand. With a lot of disturbances, how can we focus in studying at home? And how can we improve our studying habits in the time of pandemic? And how to cope with a failing grade mindset during the pandemic. Tutuloy ko na, is it worth to continue? You answer that. And then a lot of my classmates are considering stopping because they don't want to do the classes online. They feel it's not the same quality as to a face-to-face. And how do I prevent myself from feeling that way? So I'm concerned yung quality of education that the person is getting.
Yeah, and sabi nga dito, and there was a comment that professors have problems too. Yes, of course. I think everyone is affected. RJ, you might want to answer that.
Yeah. Siguro it's very clear naman that the online method of learning is not always at par with the face-to-face intervention. Una sa lahat, nawawala niya yung social way of learning. Like, for example, you learn from others by interacting with them. So, hindi talaga siya ideal na platform. And yun nga, parang even though that we're already discussing yung mga blended learning and everything, hindi pa rin niya na-replace yung face-to-face. So, probably because of the situation, probably we also need to be very practical about it, no? Kailangan natin tanungin sa sarili natin kung magde-decide ba tayo na mag-continue or hindi. Depende dun sa need natin. So, do we need to graduate on time, no? Isa yan sa mga concerns natin. So, at the end of the day, I will not say specific action na gagawin ninyo because it will depend on your needs and your situation. Siyempre, nandiyan yung kaya bang i-support ng parents na hindi magtrabaho agad yung bata. So, isa yan sa mga dapat na-raise na concerns na kailangan pag-usapan po natin.
Thank you, Dr. RJ.
Okay.
One question here. Ang sabi niya, okay, as opposed to online learning, kung face-to-face naman daw, I think I've been having anxiety attacks. For example, I'm always scared to talk to a professor. Going to class, I overthink that I end up not doing it anymore. Sometimes I'm scared to enter the classroom because I'm a bit late. I end up not going to class. I'm scared to do my requirements and I end up doing other things. So, ang general question, what should I do?
Siguro take one fear at a time because sometimes kung pinagsabay-sabay mo siyang lahat, it will overwhelm you. So, example, if you're scared to talk to your professor face-to-face, you might want to write a letter para lang ma-voice out yung needs mo. So, find an alternate way to address it one by one pa, hindi lahat. And realize that some things take time. You're not forced naman to, well, of course, you have to go to school. But try to find something that's happy in the school para ma-motivate ka pumunta. So, parang ano yan eh, parang it's again going back to mind conditioning. No? It's about changing perspective, which will not happen overnight. Again, it's a process, but take it step by step.
Thank you, Doc G. Dr. Michael, there are questions on your end. I know.
Yes, yes. Some of the students, again, we realize that doing remote classes might be difficult. Okay, so another level of that for that question is the learning capabilities of the students. So aside from you being calibrated with the online learning, you also know that you might have different learning styles, learning routines compared to the other students. So what could be what can we do, or what can you suggest for these students to address that?
Okay, learning style kasi is varies, no? Some are very visual, some are very, they have to read it, dapat may methodology. Find your learning style. I think that's one. And you have to be comfortable kasi in the way you learn about things. Like you cannot force me to be always methodological. Minsan talagang visual person ako. That's how I learn. And through that, I just, get the theories out of it. So, wala siyang one size fits all na style. Pero, ang challenge na lang doon is how you're gonna turn it na parang mas maiintindihan mo yung subject. So,
Okay.
that's the way I did that. That's the way I did it when I was in med school before.
So we really have to expect meron talagang may adjustment phase talaga.
Yes.
Everybody will be adjusting in the new normal.
Yes, that's
Oh.
right.
So another question po, ma'am. Some students are saying, again, everybody has different coping mechanisms. Some could be very positive about this. Some could be a little less positive. And sometimes, those who are positive, uh, uh, that would have a positive outlook, sometimes they are ridiculed or they are told because you're just privileged, that's why you are coping well. So how could you address those kinds of negativity coming your way when you yourself is a positive person?
RJ?
Sa akin kasi parang it's very difficult to assume what a person is feeling. No? So parang we can't judge them na ito mukhang nagko-cope siya kasi nakaka-post pa siya sa Instagram, nakaka-post pa siya sa Twitter ng mga plants niya. So parang siguro we can't be judgmental. I think that's the basic point. And we allow them to express kung ano yung ano nila, yung way of coping nila, as long as it doesn't harm other people, no? Yun lang naman yung pinaka non-negotiable doon. So recognize yung yung coping strategies ng iba.
Okay. So yung coping strategies din kasi na yun, di ba? Kasama yung whole environment. So sometimes you would sabihin natin, na-involve natin ang school administration and faculty. They're very supportive. Na-involve mo yung friends mo. Na-tone out mo na yung mga negativity sa social media. But you're left in your homes. So, which is an area you cannot escape at this time. So, actually, when the lockdown started, even other countries, that was a problem that was expected to come up because everybody will be left at home, walang coping mechanisms. If they are not as happy with the family setup, it would add to the anxiety. So how can we address that given that they need to stay home?
Or you might want to have a support group where you can talk to. Kasi part of planning in terms of return to school, online or not, is to have a ready network of support where a student can run to kapag meron siyang mga questions. Yan, especially that that's a major adjustment, no? And not only students, I think professors should also be involved, should also have a support group to run to. So again, mental health is really a collective effort we make. We cannot work on it na ako lang. It really has to be a collective effort of a community of support. Or yung sinasabi lagi namin, community of care. And so I think that shouldn't stop, that support. Even if there's physical distancing, it's still possible. So I hope we get to revive that.
Okay. I think another question, right now, how we have questions possibly from faculty members or
Yes.
concerns of students regarding faculty members. We have to accept kung may anxiety ang students, may anxiety rin ng faculty. I think some of my students would know sometimes I could be that way too. Diba? So aside from understanding each other, what can we suggest to faculty members on how to prepare for the incoming school year to help the dental students also? Aside from preparing their lessons, their online lessons.
Yeah, I think a very important component for professors naman is to be able to communicate to their class yung kanilang plan. What lessons that they're gonna take. And sabi nga ni RJ kanina, kumustahan is very important. Yung before ka mag-start ng lesson, pag narinig mo pa lang yung prof mo na, oh guys, how are you feeling today? Parang nakaka-ano siya nakaka-relieve ng anxiety. So, I think it really is about open communication between the professor and students. I think that will make it work more. So, yun.
Yeah. Just to also add, aside from dun sa, I think DepEd already came up with a proposal to have the first week of classes spent for debriefing sessions. Kasi somehow we're all affected with this pandemic, no? And of course, kasama dyan na yung pagkakaroon ng gradual transition to the schoolwork. So probably we need to also pace yung mga requirements that we give to the students. And also offer support, no? Lalo na if we know that the student is already having problems with regard to their performance. Kasi nung before, nagturo ako sa isang college sa mga college students, nakita ko na pag kunwari merong problems sila in terms of performance, probably merong underlying reason why that happens. So when I try to check up on them, as in meron pala talaga silang pinagdadaanan. So it might not be a mental health problem in itself, but it can be a psychosocial stressor. Like for example, a family or a relationship. Those are real situations that can affect their performance. So probably, kung ganun na, we have to have a high index of suspicion. Ibig sabihin parang we have to refer them agad na to a guidance counselor or even just a conversation with your students will already help.
So dapat ito nga general empathy to everybody.
Yes.
No?
Yes.
Oh. So aside from that, we discussed the students, how they would deal with the school administrators, with their family, with their friends. Now, since biglaan nagkaroon ng lockdown, they have ongoing cases. So some of the patients they are saying are reaching out to them. So nagkakaroon din ng discussions. Minsan nagkakaroon ng sisihan bakit hindi natapos. So how aside from what to tell the patients, how can they deal with the patients?
I think, again, open your lines of communicating to the patients. They also have to realize that lahat tayo affected and it's for their own safety and for the safety also of the dentist. But communicate a plan kasi patients also need to know kung ano yung mangyayari sa kanila. So you might want to set a timeline for them na, ito pong week na to, hindi ko po muna kayo matitingnan, pero by June 16, kahit 2 hours, yung mga ganon. Pero kasi what they need is some form of clarity that they will be attended to. So that's based on experience na kahit online, touch base with them, lalo na yung mga long time na patients or yung mga patients na nabitin sa kaso, explain to them na ito yung mangyayari, andito na tayo. Again, have a clear communication plan rather, para naman din ma-ease out yung questions ng pasyente.
Alright. Okay.
Pero just to also add, I know of some departments at PGH that hindi sila maka-full operations because naging COVID referrals. So probably we can identify other ways on how we can help them. So, like for example, if health education, malaking bagay na yun sa kanila eh. And of course, yung kung kailangan ng refill in terms of medications, probably that is a service that we can do kahit na online rather than focusing na parang, okay, wala tayong magagawa because of this pandemic. So probably we just need ways on how we can be helpful to the patients.
Okay, so just to maybe educate and look for ways to refer them, siguro.
Yes.
Okay, siguro. I think we still have a lot of questions, Dr. Rochelle, but I think time is running out.
Okay. I'll just finish two. Because there are two ends of the spectrum. I think this needs to be addressed. As a student, I would just like to ask, how do we deal with or clinical instructors that are instigating fear or anxiety, either in the academic or the clinical setting? On the other end of the spectrum naman, is an educator asking, how can you identify the differences of your students' learning abilities, and therefore, how will you approach these differences to allow each one to cope with the new norm in learning? So opposite ends of the spectrum, I had to ask it.
Oh, okay. Well, that's again, that's about learning style, no? Tama ba, Rochelle?
Yes, yes. Ang
Uh,
gusto niya, to identify the difference now of the students' learning abilities. How does she learn to do that now?
it will take time. It's not a one time na malalaman mo na lahat kung ano yung, in fact, lalabas pa yan when you give exams, ganyan. You might want to have one-on-ones with them to get to know them. In fact, that's one learning style that's very much appreciated by students. I know of a school that schedules each student 1 hour a day para lang makilala, out of school. So with that, ang ginagawa ng professor, kinocollate niya lahat ng mga feedback ng students and then retrofit niya yung lecture based on feedback. So parang ganon, you might want to go to that path, no, of being able to communicate with your students. Para ano naman, it's not like professor ka, student ako, parang hindi na tayo pwede mag-usap. So there's some form of leveling that has to happen, but syempre, respeto pa rin as a prof.
Yung isa naman, nag-instigating fear daw from the instructor. Madami yan, and that happens.
Oo nga. Well, fear is okay up to a certain term, up to a certain extent, but wag naman yung threatened fear na ganon. So, depende sa context ng fear. Sometimes you really need a little bit of fear to learn, but me personally kasi I don't believe in tatakutin mo para pumasa eh. Parang tatakutin mo bago mag-aral. So iba-ibang. I think we should shift away from fear and go towards motivation. Yun na lang. That's my take on that. Imbis na takutin mo, i-motivate mo na lang. Mas dodoble pa yung effort nila.
Kasi dapat merong certain level of leveling off with regard to faculty and how their participation sa class impacts their students. Kasi minsan pag akala, parang syempre very traditional pa rin yung iba na fear-based, tapos it can probably hindi magsasalita yung mga students afterwards. So the idea there is to have a space na safe for them to actually voice out. Kasi doon naman nanggagaling yung learning pag nagkakaroon ng diskurso between the teacher and the students. And if we hinder that because of fear, then we won't actually maximize yung mga platforms that we have.
Thank you, Dr. RJ. We need to wrap up, but I have this one question. I think it's important. Last na to, promise, to the IMF. When with the symptoms, what symptoms does a person feel to seek help of a professional?
Okay. Dun tayo sa 5 Ds na hindi ko ma-memorize hanggang ngayon. So RJ ko na take 5 Ds. Basta 5 Ds yun. Remember that.
Okay. Well, of course, lagi naman namin hina-highlight na you don't need to have a serious mental health concern before you reach out to a professional. Kahit yung mga day-to-day concerns natin, we can always reach out to our guidance counselor and mas cost-effective siya rather than hintayin pa natin yung serious na mental health problem. So, of course, this is not a diagnostic talk, no? And the symptoms might vary depending on the mental health problem. Pero ito yung mga clues where you need probably additional encouragement to seek professional help. Number 1 is dysfunction, no? So, is your function already affected? So, nakakatrabaho ka pa ba? Nakaka-function ka ba sa school? Yung relationships mo ba ay okay pa? So, that's dysfunction. Pangalawa is deviance. So, does your behavior compare to other people? So, halos same lang ba yung reaction mo to a stressful situation as compared to how others would react to it? So, pag hindi, then probably it's time na you need additional professional help. And then, of course, distress. So, yung dysfunction mo ba, tsaka yung deviance in terms of behavior, does it cause an internal distress on your part? And of course, nandiyan yung danger. So, does it pose danger to oneself? Ibig sabihin, self-harm or even suicide? So, pag ganon, red flag na agad yan. You need to refer immediately to a professional. And of course, if you are at risk of being violent to other people, so syempre pag hindi na tugunan yung mga serious mental health concerns, they might actually become violent. Pero very small percentage lang naman yon. And of course, duration. So usually pag mas matagal na yung mga symptoms, probably hindi na siya yung normal reaction natin to a stimulus. Because aside from yung stigmatization, we also need to guard ourselves with regard to overpathologization of mental health problems. Kasi hindi naman lahat kailangan ng specialist services. Kaya lagi namin hina-highlight yung need for community-based care and informal community support.
Back to you, Rochelle.
Thank you, RJ. Thank you, Doc G. We need to wrap up. Thank you. We'll turn first to the UPCD Student Council President.
Okay.
Yan, are you ready? I want to see if she's here.
Hello po.
Hello, Yana.
Good afternoon. Good afternoon to everyone and warm greetings to all of our panelists and attendees. On behalf of the students of the UP College of Dentistry, I would like to thank you, Dr. Gia Sison and Dr. RJ Nagit, for sharing their time and expertise on this very timely topic. Thank you po for highlighting that whatever we dental students or not, whatever we are feeling right now is valid, especially because we feel every day the effects of this global health crisis. And lalo na po yung sa stigma, stigma prevents people from seeking help. So discussions like this are important in building understanding and raising awareness of the fact that mental health problems can affect anyone and can present in many different forms, especially those in our field na sobrang affected ng pandemic na to. And I will also like to acknowledge the presence of our Chancellor earlier and our Dean for being with us today. And thank you also, of course, to the UP Dental Alumni Association President, Dr. Rochelle Javier, for always being supportive to the students. This will not be possible without you. Again, thank you to all the dental students of the Philippines, teachers, parents, and others who attended Teeth Talk. May we always remember that self-care is not selfish. Take care and stay safe and stay healthy to everyone. Thank you po.
Thank you. Thank you, Yana.
And to our accommodating speaker, Dr. Gia, for sharing your time and your interaction, with the students. Dr. RJ, thank you also, your insights and your insights and your thoughts. And a fresh perspective also from Dr. RJ. We appreciate you, both of you, and your advocacies. Thank you, everyone, for continuously supporting the projects of the UP Dental Alumni Association. In behalf of the officers who endeavor to bring relevant projects, namely Drs. Monica Sison, Jamie De Vera, Michael Mendoza, Jocelyn De Guzman, Mark Pilas, Elch Barroso, Melanie Serra, Grace Gonzalez Martinez, our advisors, Dr. Junjun Clemente, Dr. Paul De Castro, Dr. Chico Achacoso Damata. Thank you to the EXICOM, headed by Dean Danny Magtanong, Dr. Charlie Atienza, Dr. Chrissy Loretta, and faculty in charge, Dr. Arevalo, for making it happen. To the IMS team of Sir Darwin, Sir Alvin, and Director Geoff, thank you very much. Doc G, thank you once again. To everybody, an edited version of this webinar will soon be uploaded on our YouTube channel called the UP Dental Alumni Association. Thank you everyone for making it happen. Keep safe. At muli po, mula sa aming mga tahanan ng UP Dentista para sa Bayan, maraming salamat po hanggang sa muli nating pagkikita.
Thank you.
Thank you, G. Thank you, Dr. RJ. Mark?